Joining us now, Dr. Shane Creado is a physician who studies, is a psychiatrist in sleep medicine at the Amen Clinic. So appreciative of your joining us, Doctor. Obviously, a heavy topic.
Good morning. So, Doctor, our thoughts and prayers are with the 4 innocent victims who lost their lives that tragic day. But there is a growing conversation about CTE. Can you explain to us more about the condition, what it is, how is it treated, and what research is being done to actually help those who are currently suffering with it?
Absolutely. Right now, CTE is considered an autopsy diagnosis, actually, which means it can only be confirmed by examining brain tissue after death. But waiting until someone has died to know whether they have CTE doesn't help the person or their family. So at Amen Clinics, we use SPECT imaging, brain imaging, and other advanced tools to look for patterns of dysfunction after head injuries, especially in the frontal and the temporal lobes. So traumatic brain injury is the major contributing factor to CTE, and those patterns of dysfunction can build up over time. So repeated injuries, worse risk for developing this condition, and depending on the areas damaged, different symptoms can manifest.
Got it. Yeah, can you elaborate on some of those symptoms? A lot of people say you can only tell if you have CTE posthumously, but if you were thinking you might have it, I mean, you study the brain, how would you know about this?
Yeah, so SPECT imaging can be used. It's a very sensitive tool for head injuries, and we can see changes decades before severe symptoms such as dementia may manifest. So, for example, if the front part of the brain or the prefrontal cortex is damaged, you're going to have lower empathy, more impulsivity, more rash decisions, more susceptibility to substance use issues. Lack of empathy and lack of emotional awareness, lack of human connection. Our humanity is affected in a way when those areas are damaged. And the temporal lobes help us with regulating our emotional pendulum and helping us with forethought as well. So when you have those combined damages kind of interplaying over here, you have a situation where someone has less empathy, less humanity, more impulsivity, and more susceptible to being hijacked by their emotions.
Interesting. Let's expound on that. There's a growing trend with the amount of mass shooters who have some sort of mental illness. Can you speak more on this, and what can be done to actually bolster our institutions to be able to get them to the right support and pathway back to some type of normal life so that way they don't suffer and don't harm others?
Absolutely. That's exactly where we need to focus our resources and our energy. What can we do about preventing these kinds of things, and what can we do to treat people early, diagnose them early? So this administration has taken the lead on that, actually. Our clinic's actually working with this administration on developing a framework for brain health. So we approach mental health as brain health and whole body health because there's many factors that can damage your brain. Sure, head injuries are one of those things. But if your brain is already more vulnerable because of the unhealthy foods you consume or substances you use or the kind of water you drink or the nutritional deficiencies you have, it's going to just compound the effect of other head injuries. So awareness, education that mental health is brain health and brain health is whole body health. And Dr. Amen has come up with the Bright Minds risk factors for brain health. It's an acronym where B is for blood flow issues, R is for retirement and aging, I is for inflammation, T is for toxin load. So we look at all these risk factors and say, well, here are the things that are sabotaging your brain health. Let's fix those issues. And here are the things to boost your brain health. Let's do those things.
Yeah, I know a lot of people, as I'm sure many of us do, who were actually working in the building at the time, and now they're very concerned about going back. We all have heavy hearts, but it could have been any one of us in that building at the time. Many are saying they might have PTSD, even going back to work in Midtown. I mean, these were horrific images that we were seeing with respect to the shooter and everything, hearing the play-by-play of what actually occurred there. How can people who are experiencing this sort of trauma, whether they were in the building, whether they were headed into the building, and the like, overcome this? Because to think about that circumstance is really frightening and traumatic.
Absolutely. Again, a very important point. There's something to be said for survivor's guilt, where people who've
Mm.
survived major calamities kind of feel guilty in a way that they survived and other people didn't. They also have close friends and colleagues in the building. And of course, then is, can it happen again? What are the authorities doing to protect us, prevent such situations? But what can we do to help our neighbor, help our friend, help our family member understand that if there's a mental health issue, there are resources. We can look at their brains, we can check in on them, we can come together as a community, as a family, as a nation, and support one another. And the stigma is still there when it comes to mental health. But knowing that there are resources, that they're not alone through these things, is going to be a really critical piece of getting people back into the office, back into their communities, and coming together in a meaningful way. So I would say for those who are suffering from this kind of emotional trauma, connect with your resources, connect with your faith, connect with your family members and loved ones. And it shines a light on what's truly important in this world.
Yeah.
At the very least, family members and your faith. I remember after 9/11 being able, or I should say fortunate to escape 7 World Trade Center. I went through some emotional, I guess we can say guilt, because I was able to get out. And I thought about a lot of my former colleagues and 2 World Trade Center, the building that collapsed second. But what type of advice would you be able to give our viewers that are actually going through some emotional strain and trauma that they withhold internally, and many of the people in their lives don't even know?
If someone truly loves you, they'll be there for you no matter what. And again, you're not alone through this. When you talk about your shared difficulties, it's not, all about complaining or being a burden to somebody else. You find who your true friends are. Those who are going to stick up for you, those who are going to be with you, weather the storm together. And I think that's what's so powerful about this situation. Can we transform this kind of situation into hope, into meaning, into purpose, into looking at our brain health, looking at ourselves in the mirror and saying, what can we do to protect our own brains? And what can we do for our neighbor, our friend, our family member? In that process. Let's be buddies. Let's be a family in brain health optimization, thereby reducing the risk for further issues. And if there is a traumatic event, if there is a head injury, guess what? Your brain is going to be more resilient to bounce back quicker. So I would argue that actually talking about and seeking resources about the things you're facing internally is a demonstration of strength, not
Yes.
weakness.
Couldn't agree more. And destigmatizing mental health issues, as well as studying the brain, which you are doing, will be incredibly important going forward to learn from this. Dr. Shane Creado, thank you for joining us this morning.
Thank you for having me.